part of the project, we only were measuring the heart failure readmission rate, and we unfortunately did not make a significant decrease in the readmission rate. And we also had a small disparity. Blacks got readmitted more than whites, but no ethnic disparities. Hispanics were equal to non-Hispanics, actually a little bit better compliance with the Hispanic population. So we hired an outside consultant to do patient focus groups and survey our patients, and we found some interesting things. The patients said, yeah, we don't always take our medicine as prescribed. Sometimes we have side effects, or sometimes we think we can't afford it all, because some of our patients have to pay certain copays. And they felt more comfortable talking to the consultant about these things than they would to their doctor. So we have to work on that communication, that the doctors aren't feeling like they're saying you have to do this, 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 and this, and not listening to what the patient side is. Also, there are other aspects of the patient's care plan that they were not complying with. And again, it was for concerns about the cost of the services, especially medications and referrals. And even though the cardiac rehab program was free, some of them were really reluctant to do it because they really were afraid they were going to get billed. So patients have a real concern about financial issues there. Also, they have other responsibilities that take precedence over their health care. They may be having more than one job. A lot of people think that uninsured patients have no job, that they're just, living off of the system. Actually, 80% of uninsured patients have one job, and many of them have more than one job. And a lot of times their jobs do not really allow them to go and spend time, in a clinic. So they have these competing interests. They also sometimes are caring for other family members that they put before themselves, children or elderly parents. And this one here, incarceration, I put this here because I want to tell you, never give up on a patient. One of our most compliant patients in our cardiac rehab program was a gentleman who ended up violating his probation and ended up in prison. Called from the prison to our cardiac rehab team and said, I'm so sorry, I'm going to miss the next several sessions because I violated my probation, but as soon as I get out, I'll call you and we'll reestablish it. So never, never, never give up on patients. Don't stereotype them at all, okay? Our eligibility process is cumbersome. We're working on that and streamlining that. We have certain basic information we must collect from patients because we are partly tax assisted. So they have to prove that they live in our district and income levels and things like that. And we're working to make that less cumbersome. Also, some of our clinics have long throughput times, and some of the clinic front desk staff were perceived as being unfriendly. Now, you would think that means you have grumpy people behind the desk. Well, that's not really what we have. But you'd be surprised what patients in different cultures and different levels of self-esteem might consider to be unfriendly. So all the staff, everybody, from when patients come through the parking lot to when they greet the security officer in the building, to the financial eligibility staff, to the people at the front. Look at all these places that patients have to go to or calling on the phone before they even get to the doctor. Anywhere along the way, if those people who are working in those positions are not going above and beyond to try and make the patient feel comfortable and safe and welcomed, then the patient may run away and never come back. So all of our knowledge of evidence-based medicine would be for naught because they wouldn't even be there to take advantage of it. Oops. Okay, so just to talk about what we're going to be doing next, just to let you know, we're going to move to a more aggressive disease management program that's going to involve cardiologists and nurse practitioners. We've already located our space and walked with the architect last week, and so this is going to be exciting. We learned this in the collaborative. There were two programs. Duke used a cardiology clinic in an FQHC, and University of Mississippi used an ARMP-run clinic. For patients with heart failure, they're teetering on pulmonary edema at any moment. It's really important to have the provider who they're contacting to be able to make an intervention, to change their medication or bring them in and take care of them. So we're going to this model. We already talked about the eligibility process redesign, which we've already started really making headway on, and all of our staff really being trained in service excellence to go above and beyond for our patients. And then again, data collection is very important to collect data in the outpatient setting. It's not as easy as an inpatient, but we do have data. We're looking now to find a data analyst to help us because large volumes of data in the outpatient setting, we would like to approach it just the way we did the inpatient. So just to add to the specific elements that we talked about before for success, in the outpatient setting, there are a couple extra things you need to think about. And the comprehensive integrated healthcare system, I think that's obvious, how the patients have to have some place to go, and those places have to be welcoming. You have to welcome the patient. I'll show you the picture of the chronic care model just briefly for those of you who may not be familiar with it. And then to just emphasize what you guys are already doing, and that is community outreach, reaching the patients where they are in the community, especially those areas where you have patient populations who don't trust or need to be a bit more engaged to feel comfortable coming into your healthcare system. Compassionate, culturally competent, and patient-centered medical team. Can't speak enough about that. It has to be every level, just as I described. Every way leading up to the physician, including the physician, the nursing staff, everybody. Welcoming, clean, and pleasant environment. We really emphasize that. We are sticklers about clean floors. Pastel paint on the wall doesn't cost anything extra to put a nice environment for the patient. And then, of course, bottom line, adherence to evidence-based guidelines and making sure that you have your forms and your processes in place. Supplementing that with the patient education and the navigators that keep the patients from falling through the cracks. Regular review of outcomes data, continuous quality improvement, and again, accountability. Everyone has their role to play. Everyone's held accountable, and confidence that your goals are going to be met. So I'm just going to end here with this is Wagner's chronic care model. Here we have community with resources and policies that assist patients with their self-management. And we interconnect with the healthcare system, overlap for the delivery system design, decision support, clinical information, all that data you need to make sure that your system is actually doing what it's supposed to do and following evidence-based medicine. When you bring this all together, you have an informed, activated patient interacting with a prepared, proactive practice team, and these productive interactions lead to improved outcomes. This bottom part down here is what you may already hear about, the patient-centered medical home. That's that model there. But look at this. You need all of this, including community, to support that. So I'll just leave you with this picture, which you saw already, and that is just to give you a sense for where Memorial Healthcare System is today in terms of trying to reach for that excellence. You guys are doing it too. Reach for the excellence along the whole continuum of care. And that way, as you get to exceptional, high-quality care for everybody, the issue of disparities goes by the wayside because, by definition, you eliminate disparities. Thank you.